4th episode, Therapy Tea Time Talk. Welcome again, everybody. We have another special guest coming up onto our show today. She is a certified massage therapist and the founder of Caylon Ellis Therapeutics. And her name is Caylon. Welcome to the show today, Caylon.
Thank you for having me. I'm looking forward to this interview. I think that what you're doing and the information that you're putting out there is really important and useful, and I'm excited to hopefully be able to contribute something to people that helps them decide kind of what paths to go down and maybe what paths to skip to just make the journey a little more streamlined, because mine was not.
Yeah, thank you very much for coming on the show to do some sharing with the rest of the people. I'm sure people will learn a lot from you and from your life story as well. So Caylon, what is your profession and how long have you been doing it for?
So I'm a massage therapist. I'm a certified massage therapist. In the States here, there's kind of different levels of certification. So I have a state license and a board, which is a national certification. And I've been doing massage therapy for 12 years, but I've definitely evolved over the course of when I graduated from massage school and how I was practicing compared to how I'm practicing now. In the past, I started out just seeing people in their homes. I was doing out calls because I wasn't really planning on building up a practice or wanting to build up a practice. And so as things kind of naturally evolved and I started working with more people, I was renting space from an acupuncturist, and then I teamed up with someone else and was just renting an office space. And that's what I'm doing currently. It's just me. I'm a sole proprietor and I have an office it's just me, but it's in a larger, just mixed use office building with people of all different sorts of professions. So I just have my individual office space, and that's where I practice out of.
So Caylon, what is your current role within the healthcare system?
So I see myself as filling a little bit of a gap for people that don't feel like they're getting what they need from other kinds of help and modalities. And the way in which I do that is I provide quite a bit of education, teaching people how their body works, how the brain connects to muscles, what the kind of optimal patterning is, and teaching people how to feel what's going on in their bodies. I think that sometimes with just the nature of how different kinds of professionals and practitioners are set up, that lends towards not having as much time as they would like to have with people. Like I know that some medical doctors get 15 minutes with people or a half an hour with people, and you can't accomplish as much as I can accomplish with a larger window of time. So I fortunately have the flexibility of time to give people more information and make sure that people can connect to things and understand things. So I see that aspect of being able to provide that in the setting that I work, and making my own schedule and working for myself as really kind of filling a little bit of a gap or a void in spending more time with people to help them understand why things are happening the way they are, to give them the extent of information to which they want to know why things are happening, and then work with them together to work towards, okay, how do we get better strategies and kind of clear out some of the things we don't need, and learn better habits and work with them to make sure that they understand. And I just think that some professionals, even though they want to be doing those things, they're just not set up to be able to do those things. So I can kind of help out with people that are in that sort of limbo zone of not being able to get that kind of help from different kinds of professionals.
So now take us back all the way to the beginning. How did you originally get started in this area?
So this is always a fun question, because I honestly went on a whim and just decided to go to massage school. I really can't tell you what it was. I think some sense of inner knowing of somehow I would end up being able to help people in a way that at the time I absolutely had no idea what was in store for me, because when I graduated from college, I had a whole different life plan, and some kind of personal stuff happened where I ended up graduating a year early from college and moving back home to help my dad run a business. and I'm still doing that, by the way. And then I just kind of over time went to massage school just because I like learning about things, and I thought that it would be kind of fun, I guess, to learn about the body. I think somewhere in my mind at that point in time, since I was running a business and I had flexibility, I thought it'd be kind of neat to be able to learn how to do something that I could work for myself and have more flexibility. And I think that just as a kid, like my mom would always ask me to like rub her back, and even like in college, some people like, oh, my back hurts, will you rub it or something? And so I've been, I guess, kind of familiar with like touching people, even though it kind of freaked me out. And I didn't realize the extent of that until I actually was in school, and I found myself having to touch people that I didn't know, and having people I didn't know touching me, and realizing that was actually kind of uncomfortable. But I think that's also part of why it was helpful. So yeah, so that was whatever that was. And the school that I went to was very out of my comfort zone as well. It was the language I would have used at the time was like a hippie, like touchy-feely school, where it was we sat in a circle and had these like rituals, and it was kind of like kindergarten for adults is kind of how it felt to me. And that made me really uncomfortable, because my background was always more of brain, mind, linear, logical. And so having like breathing and Zafu pillows, like I didn't know what a Zafu pillow was, and meditating, like going through all that process made me very uncomfortable and made me very determined to not actually do anything with massage when I finished school. But I stuck with it. I kind of, towards the end of my program, I got more introduced to some more kind of clinical based modalities. And that got my interest, because I've always liked figuring things out and solving problems and being challenged, and not just learning how to do something and then you do it and get really good at it, and then there's nowhere else to go from there. You just keep doing the same thing over and over again. And that's, to me, what I thought massage was at the time, was like, oh, you give the best Swedish massage or the best neuromuscular massage or whatever kinds of styles. And then you're good at it and you just always do the same thing. But then I kind of got exposed to the more clinical side of things that kept my possibilities open, even though mentally I still was decided, like, I'm not going to do anything with this. And like my business plan for coming out of school and creating a practice was, I decided I didn't want to invest any kind of time into actually seeing what office spaces were to rent and doing it. So I just made this plan that I was going to work on a pirate ship and stuff that was not realistic, and my teachers weren't thrilled with me, but that was the degree to which I really wasn't planning on using it. And then over time, because that was in 2008, I just got connected with people that I was able to help. So I figured I like helping people. If people want me to help, then I'll help. And just word spread. And so I would work with people on a very limited basis. But that's kind of how I continued to evolve, was just wanting to help people and then encountering people that had things going on that I didn't know how I could help them. So I wanted to learn more about it. And then that's what pushed me into the whole continuing education, never-ending journey that I'm still on, and started learning about more kind of involved techniques and how to work with the nervous system and how to work with energy and how to work with trauma and really just continuing to expand the horizons of how I'm able to help people in ways that I never would have imagined were possible and that were very much outside of my comfort zone, but I just kept doing it anyway because I love learning and then being able to teach people about what I learned and being able to help people. So that was kind of, and that's still where I'm at. I'm still learning new things and just continuing down that path.
So in terms of your specialty within your area, it sounds like that you do a lot of work in relation to the mind, body, and movement as well, if I'm correct. And also, do you do a lot of palpation in your line of work as well in that case? And how important is that to you?
Yeah, to me, yes, to everything that you said, and starting with the palpation, hands-on work, that I love doing that because the body will tell you what's going on. Like, people will verbally say, oh yeah, like this hurts and this is the problem and this has to be the problem. And they probably think they're right, but how the tissues feel and how the joints move, and then even kind of backing up a few steps and tapping into like people's energy fields and their nervous system, sometimes that tells a different story, and that will lead you more to the underlying reason of maybe why that problem is a problem, because it's not always 100% just because something's hurting somewhere, that's the reason why it's hurting. Sometimes it is, sometimes it's not, but that's why palpation is so helpful, because the palpation will help you tease out and figure out where some of the underlying root causes are, and knowing how what a normal neutral joint range of motion or tone of a muscle, that gives you an idea as to whether or not something is at a baseline that's healthy and optimal. So that can be really really useful information. But with the whole current world situation of the lockdowns and not being able to see people in person, I think it was 3 months or maybe just over 3 months of not being able to work hands-on with people. So that pushed my boundaries and comfort zone of how I can work with people without being able to put my hands on them. And I have learned that I can also help people working remotely, just like we're talking right now, and being able to tap into someone's nervous system and feel what's going on, and use some methods that I've been trained in, and then some things that I've kind of just come up with because of curious experimentation, to still be able to help people without being able to touch them. And I love having that option, because sometimes people, whether they live in another country or now they're in a more of a higher risk category, so even though I'm allowed to have my doors open, some people they don't feel comfortable yet, or maybe they won't be able to for a year or so have my hands on them, that I still have some ways that I can help without being able to touch. But my preference is touching and palpation and working with people, because I love doing that, and I love the human connection and being in person. But I also love that I have another option if that's not a possibility.
So I think you might have elaborated on this before already, but you can maybe provide us with a bit more detail in terms of this question, because you mentioned about how you were continuing your clinical education as well. So we're wondering, like, how has your methods of finding out what happened and treatment sort of changed over the years?
So my process has definitely evolved as I have evolved just as a person and as time has passed. And I like to use analogies, so I'm going to use an analogy. It's how I used to approach assessment and treating and helping. It's kind of like the first time you cook something. If you have no idea how to do it, you're going to look for a recipe, you're going to get all the ingredients, you're going to follow all the steps like in order with what they say and exactly how to do it, and not really play around a whole lot. At least that was my approach. I didn't feel like, oh, like, how do I know that I can use a little more or use a little less? Because you do that, and then so you have this template and these protocols and these directions that you follow. But then when you get more comfortable and more confident with protocols and having all different types and learning different modalities, because then that basically gives you different recipes or different protocols to follow, and then you recognize more when, oh, this person would better be served to use these kinds of protocols, or energy healing versus more kind of biomechanical stuff. And then you get more comfortable and you get more confident. So then you start to play, and then you get to where you really don't use recipes anymore. But when a recipe is useful, it just sort of comes to you, but you already know what steps that you can skip, because you know you've done things so many times and you're so familiar that you can already get a sense of when it's okay to break the rules and when you shouldn't even follow rules. And that kind of evolution has led me to how I approach things now, which is loving and honoring what's all in here, my brain and all the things I've learned and all the linear thinking and pain pathways and the parts of the brain and responses and all the muscles and the joints and how they move and all of that, where I approach that as a library or a catalog of information that when I know I want that, I go to the book that I want and pull it out and open up and use the information, put it back on the shelf, set that aside, and then put myself back into what is my default mode as feeling things and listening. And then when by feeling, and I mean that literally and also not literally, figuratively, as far as like feeling what the body's tissues and joints are telling me, but then also the non-physical feel of just the feel of what's going on, of like, if I touch certain areas of the body, sometimes I start to just feel like I'll get hot out of nowhere. And so then that kind of makes me think, maybe there's some kind of a energetic based thing going on in this physical area of like kind of some emotions that are tied in with this muscle or joint that's all locked up. So, but I don't think my way and logic my way through working with people. I feel my way and listen. And then when something comes up and it would be helpful to turn on my thinking mind and get into that catalog and pull out the information about, well, what's the normal passive joint range of motion and how should this joint move actively and what muscles are involved? Then I use that, apply that and say, oh, okay, good. And then just kind of put that back on the shelf and just go back into more of that receptivity feeling mode, so that I'm not like forcing things and doing things to people, because I definitely used to do that, thinking that was the only way to do it and the best possible way that I could help someone. But now I've just learned that the best way that I can help someone is to be receptive and to listen and to work together with people. And that's the whole intention underlying the whole approach, is I'm working with people and helping them figure things out. Like, we're partners and following clues where they lead and not trying to force things and make certain things fit. Receptivity mode is where I do my best to work from and stay receptive, which means I'm listening more to what's happening and not just doing things just because I can. There's, at any given point in time, there are so many possibilities of protocols to follow and what you can do and how you can do it. You could have me, you, a physical therapist, a chiropractor, all different kinds of people that can look at the exact same situation or problem and even assess that, oh, this is what's going on, but then what do I do about it? We could all do it differently. All of it could help somebody. So I just honor that there's a lot of different possibilities. I don't put the pressure on myself like I used to, that there's a way or a correction or the right correction, and that I have to figure that one out. That I listen to, in that moment, the preference of what the nervous system wants or what somebody's body is responsive to, instead of, and it's a challenge to do it, but instead of just doing things and not listening to, well, like, how is this actually working out? I think that I get much better results doing that. And every now and then I catch myself sometimes just kind of out of default mode where maybe someone's talking to me and I get distracted. So I just start doing something without knowing why I'm doing it, or just kind of doing something like just doing tissue work when it's not really responding. So then I kind of slow down and say, okay, well, I've been doing this and there's no response to the tissues. So hold on, let me back up and listen and sort of troubleshoot why this might be happening, which is, I challenge myself to try to be in that mode all the time, but realistically, I'm human and there's days where I'm more tired or more susceptible to kind of slip into that mode. But it's a challenge to just constantly be checking in, to be receptive and listening and not just doing things to people. It's working together as a team and figuring things out and listening and making my next choices based on how are the current choices being received and where does this take us, and being open to that shifting course instead of just like, this is the course, this is what we're gonna do, no matter what. I don't care what's happening. I don't care if someone's like clenching on the table and they have no more blood in their hands, that like, nope, I'm still gonna do this because this is the recipe. I don't practice like that.
So roughly in your sessions, I was thinking about, because you have a large portion of it that's going to be based on just history taking and receiving information, and then you do your physical examination, which includes the actual portion of tissue palpation and the other techniques that you mentioned as well. So I was wondering how long your sessions are.
Yeah, so typically the first time I see someone, I leave a pretty good chunk of time because I don't know how many questions they're going to ask me, how interested they are in even understanding things, and I want to leave time to give more information, be more interactive, and some people have a little bit more of a detailed history that they want to share and give me more information. So the talking portion of the intake, that can vary the first time I see somebody, but the actual hands-on portion of the palpation and the corrections and that aspect of things, whether I've seen someone for the first time or they're coming in again, that is usually around an hour. And for me, that's more of a self-imposed limitation, because you can do too much of a good thing and have it turn out to not be so much of a good thing. So doing like hours and hours of work in the way that I do it, with kind of neurological corrections and energy corrections and physical corrections and all that combined, that doing too much can overload someone's nervous system to the point where they can't integrate all of that and keep it and continue to make progress. So yeah, the hands-on portion is always around an hour, and sometimes with people, I'll spend 2 hours with them the first time I see them, or even the third or the fifth time I see them, if something comes up to where they're telling me a lot or talking a lot, or all of a sudden they kind of realize these things about, oh wow, I completely forgot about that time when blah blah blah, and then they go into telling me about old like injury history, or even that can stir up some kind of emotions for them, which I don't go into advising people how to navigate their emotions, but it's more of when people feel safe to share certain things, I just hold the space to allow for them to do that. And I think that that's a really important part of healing, because sometimes without people realizing it, they somaticize or internalize in their body in the way of like pain and dysfunction with tissues and joints, traumas and things that have happened that they may not have thought about, or maybe because they didn't want to, or they just totally forgot. So without intentionally trying to bring that stuff up, the very nature of working with the body and things moving around and shifting, sometimes it's like that can of worms gets opened up and it surprises them or me. And I like to allow for the space if something like that happens and people have some kind of an emotional release, that it's not like, oh, well, okay, I gotta go meet someone, or I gotta go to the gym, so like here, like wipe your tears away. Yeah, and I think that people, the kinds of people that work with me, the layers and the depths that we can go to if they want to and allow for that to happen, lend more towards things like that happening. I've learned that just based on experience, so I factor in more time, but yeah, like usually typically around like an hour and 15 minutes, an hour and 20 minutes, like for just typical sessions. And sometimes too, it's like, it's an hour, people are in and out the door because they need to be, or because that's just the amount that they can process and handle, and there's not a lot of talking. So like they come in and they're on the table and we're assessing and doing things. But yeah, so anywhere from like 2 hours isn't typical, but I leave space for that. And that's just if people want to share more or talk more, or if we know ahead of time people want to do a little bit more kind of movement re-education and neurological kind of connecting to like breathing patterns and things like that. But yeah, like hour and 15, hour and 20, 90 minutes for like a first session. But then I always just kind of give that that built-in flexibility to allow for something unexpected to come up. So I'm not having to actually ask people to like, well, kind of like cork that in right now because I gotta go to lunch.
So in that case, there's no specific split ratio in terms of your sessions then in that case. Is that correct? Because it sounds like it depends on the person, how long they're able to stay there for. Is that correct?
That's correct. And sometimes too, it's like, I mean, I do have boundaries around my time and how much time that I can actually spend. Because even if I want to spend 3 hours with someone, like I can't spend 3 hours with people and honor when other people are coming in. So when I have more clients in a day, and especially now that there's more of a built-in buffer time necessary between clients for like appropriate disinfecting and for like kind of airing out the room so it doesn't smell like chemicals so I can be in it and not have a headache. But yeah, it just so if people want to talk more and they know that means like, hey, I only have like I have a hard stop on when we have to be done today. Sometimes people will choose to talk more and process through some things and then have less hands-on treatment. So when that's the situation, I'm just very vocal and communicative about this is the time we have. Like I'm happy to keep talking, but then we're not going to have as much time for hands-on. And sometimes they're like, oh, okay, yeah, I want to get on the table. And other times people will say, hey, I don't even know if I'm going to end up getting on the table. And they just talk, and that's how they want to spend their time. So it's flexible.
So in that case, I was also wondering, so after the session with your patient, do you actually give them any homework or corrective exercises to do on their own as well?
Yeah, that's a good question. There's always something that I give someone to work on because that's part of my kind of overall philosophy is I don't operate with any kind of notion that I can just do something to someone and there's nothing for them to do to keep getting better. So it's just a matter of the nature of what people came to me for. If people are coming to me more because they know they have some kind of emotionally or energetic based things, then the nature of the type of homework might be a little different than someone who is a high level or a professional athlete that's coming to see me. They're going to be getting homework that's more going to be reinforcing certain very specific kinds of movement patterns or things like that. And those kinds of people too are the kinds of people that I refer out to PTs or other kinds of movement specialists that can give them more focused and specific kind of training protocols and things like that, because that for that level of homework as far as like movements and things for me, since I'm a massage therapist and I can't prescribe exercises or things like that, but what I give people are connecting back to really basic, fundamental, developmental movement patterns. And a lot of it actually is breathing based. And everyone, no matter what's going on, everyone has some level of breathing homework to work on. And I'm really open with asking people, okay, are you the kind of person that enjoys doing things in addition to whatever else you're doing in the day? Like, are you going to be successful and compliant if I say, hey, here's 20 minutes. If you spend 20 minutes and do these things, or I'm telling them something that I know is going to take a little bit of time, I ask them, like, are you going to make the time to do these things, or would you rather figure out how you can work on these things, but in ways that it just integrates into what you're already doing? Because I want people to be compliant and be successful. And if we're realistic about what they're actually going to do, then we can work together to figure things out. Because some people, they're like, oh, I would love to have like some kind of breathing and some kind of movement to do in the morning and at night. But other people are like, you know what? I already have my routines. Like, I'm really busy. I'm a mom. I have 3 kids. It's not realistic for me to set aside 20 minutes or even 10 minutes a day or twice a day to do these things. So then it would be like just having people sometimes not do anything additionally, but their homework would be being more aware of what they're doing and how they're using their body and noticing, like, are they just standing with their knees locked out and with not great posture So then they can find, okay, what's a better way to stand so it takes some of the stress off of their body. And that's their homework. It's being conscious and aware of how are you using your body. So when it comes to sleeping and knowing how things can be optimized, sometimes it's just a matter of educating people and giving them the task to be aware of and optimize things they're already doing, so it doesn't feel like homework or actually add into a busy schedule where they're not going to be doing things anyway. So then they don't have to feel bad about not doing things that they should be doing, and they're able to do things in a way that they can actually do.
In terms of advisors in this case, would there be any advice that you think you can give to the people that are new to this field or looking to get into your field?
I would say the biggest thing is that if you already are a massage therapist or you're thinking about going into massage therapy, I would just think even more about what other kinds of things you might want to do down the line. And like for me, some of the neurological methods and the things like that I've been trained in, there's a more of a buffer zone of what you can do as a massage therapist. So, and I think too, that part of it is if you can remove the pressure from yourself that you have to do everything. So from the aspect of figure out what it is or pay attention to what you enjoy doing. And if you can remove the pressure of thinking that you have to know how to do everything in every way you want to help people, I thought, okay, well, I have to be a personal trainer now so that my scope can include giving people movement stuff and things like that. And now I have to be an acupuncturist so I can understand the meridians and work with that. And I put a lot of pressure on myself that I had to learn everything so I could be everything for everyone. And so my advice would be, that's impossible. You can't be everything for everyone. And you're actually best serving yourself and the people that you want to help if you really pay attention to and listen to what are you passionate about, and what do you want to invest the time, the money, the knowledge, and your energy into learning and being the very best at. And so then the paired advice with that, so that you can help more people, is go and network and meet people and receive other kinds of work so that you can learn what other ways people can help, so that you can recognize when, okay, this isn't something that I know how to do, but I know that this exists, and I have a person that you can see that can give you really good movement-based stuff that you can do and kind of develop those things. And so networking is key, because you'll be able to help people more fully. They'll really appreciate it. They'll send more people your way because they recognize that you really you're helping them because you want to help them, and you're not trying to just get business just to have business, and that you're doing more of what you want to be doing. Because I was just having this conversation today with somebody. I met with a chiropractor, an upper cervical chiropractor, to learn more about what we do so that we can refer appropriate people when necessary. And I was telling her as well that feeling like you have to know everything and do everything, I think is common when you're starting out. But if you starting out can have the mindset of what am I passionate about, that honestly is going to make it so much easier to attract clients to you. Like I don't do any advertising. I'm all word of mouth. And I think that's because people, it translates that I'm passionate about what I do, and I get that feedback a lot, and people appreciate that. And there's just more of like, I think a genuine, authentic feel of what you're doing with people when you're passionate about it. And so I think you're going to be better at it, and you're going to like it. And so people are going to get better results. And I think that is probably some of the best advice I can give, is find your passion, follow your passion, and don't feel like you need to be able to do everything, but keep learning about things and networking so that you can get people all the help they need without feeling like you have to do all of it personally.
And now, if you can actually go back in time and give yourself one piece of advice, what would you give yourself?
If I could go back in time, I would tell myself to be more open-minded when I was in massage school and pay more attention to the training and the different kinds of energy modalities that I was exposed to, that I truthfully was a little more dismissive of. But in spite of that, I still ended up feeling things and kind of being open. But if I would have known going into it what I know now, which is the whole point of time travel, you go back with information that you didn't have at the time, I would have asked more questions, taken more courses that talked about things that I didn't believe in and wasn't open to, because now I know that some of that I was very closed off to, and I am revisiting some of those notes and things like that. But yeah, it would be just to be more open-minded at the beginning, even though I don't think that, I think that everything kind of unfolds in a way that it gets you where you need to be. But having said that, I wouldn't mind of knowing how much more I could have absorbed, that eventually would have got me to where I am now anyway. But it would have been nice to have not been a little bit dismissive to things that I didn't understand, because my framework at the time was linear, clinical, everything. You have to be able to prove it and understand it, otherwise you can't do it. And that was, if I could have shifted out of that and not had that mindset at the beginning, then it would be interesting to see where I'm at now, because that was inevitable. But if I could have started that way, that would have been nice.
I think it's always good to sometimes also reflect back and think back to an advice that you give yourself, because the advice that you can actually think back that you can actually give yourself is also, I think, a very good way for other people to understand, because it's kind of like, you're going back in time to give yourself some insight, right? So it's also offering advices to the people that's also watching this as well, right?
Yep. Yeah, absolutely. And that's, I think, is the benefit of the going back in time, is because I've had 12 years of going about things and having maybe a longer path than I would have had if I would have been a little more open-minded. But again, for me, there's no way to know that. I think that because I didn't believe things and I was so skeptical and not open-minded, that's what has allowed me to so authentically embrace things now that I wouldn't have been able to embrace then. So I think that for this iteration of how I got on this path, that was just part of what I needed to go through. But if that's not the case for you, then everyone has a different path and a way that things unfold, that you're able, through your obstacles and what you believe and don't believe, it teaches you more things. But I don't think it's ever harmful to be more open-minded.
I definitely agree with that. It's important to always be learning, right?
Exactly. And also to keep that beginner's mind, and that this is a good thing. When I was at a training in Costa Rica in 2012, so that was like 4 years outside of school, I was really beaten up myself, feeling like I honestly wasn't pleased that I wasn't just instantly good at being able to do techniques that I learned that people had been doing for decades, and they show you, and it was like, well, I'm not doing this, and I'm not good at this, and I feel like I don't know anything, and I just wanted, why am I even doing any of this stuff at all, and I should probably just quit. And I said some things like that to one of the assistants that was that I kind of resonated with, because her kind of style of explaining was how I thought, which was like, it made sense. Because I really didn't, it pissed me off actually if I asked for help from people and like, well, I just do it by feel, and I just know what to do, and I let that guide me. That would frustrate me, and I would not ask those people for help, because at that time, that didn't mean anything to me. I'm like, that tells me nothing, because I don't know how to do that, so that I'm not able to do anything with it. But anyway, so this assistant that I was asking for help, she told me, based on all that stuff and all the beating up of myself that I did, she said, if you keep that mindset, not in the negative way of being so harsh and critical, but if you keep that mentality that you feel like you don't know anything, or that you don't know at all, don't ever lose that, because it's the moment that you feel like, I've arrived, I am the master, I know all there is to know. That is when you really are locking yourself in some kind of rigidity, and so that's another thing that I did fortunately get that information somewhat early on, but telling people before you start, like, don't beat yourself up. Going back to telling me then, like, of course you're not going to be awesome and the best at this the first time you try. But if you keep challenging yourself to want to be good at things and knowing that it's a process, and keeping that mindset and not feeling like, oh, I've been doing this for so long, so like I'm the best, there's nothing more to learn, that is really, really good advice to have at as early on as you can possibly have.
Thank you, Caylon, for that very elaborated explanation. I think that's all the time we have on the show today. So again, thank you everybody for tuning into our show. And also thank you, Caylon, for coming up to be our honored guest today as well. Thank you very much for your time again. All right, everybody, have a lovely day.
Thanks for listening.